Welcome, everyone, and welcome to this new Orthoforward podcast. We are very honored and privileged to have Dr. Luis Carriere today. Good afternoon, Luis, and very
Thank
happy to
you.
see you. It was, I don't think that I see you in the last 6 months. Last time was in your office. It was a beautiful office, actually, one of the most beautiful offices I have seen in Spain. So today we'll go through your history as an orthodontist, as an industrial guy, which is very rare. As we discussed earlier, it's very rare to see an orthodontist being also successful in the industrial career, and so I would like to discuss about that for our audience. And so, first of all, I would like to to speak about you. What is your history? If you can give us more about who you are, where do you come from, and how come you came to become a so successful orthodontist and industrial player.
Well, first of all, Philippe, I am very happy, very honored to be in this podcast, interviewed by such an innovator like you. So it's a pleasure.
Thank you.
And we'll be very pleased to share a little bit of my perspective in this beautiful interview. Okay. I am not a successful orthodontist, I am an orthodontist. And the only thing that is characterizing what I'm doing is that I try to conceptualize elements that are related to simplify the profession, to simplify our treatments in order to make life easier for the patients and for the doctors. Now, I became an orthodontist first of all because I am a tremendous admirer of my father. My father is orthodontist, and I always wanted to do what he was working on. And because I was seeing that he was so happy and so much enjoying this profession, that I said, "Hey, this must be the best profession of the world." No, I like people. I like to interact with people, and orthodontics is a little bit about public relations as well.
Mhm.
So it's a kind of a specialty in which nobody dies of orthodontics. It's not dramatic, and it's all about happiness and all about a nice and positive flow with the people.
I cannot more agree than you, and it's one of the reasons I went into the orthodontics field.
Yes.
I was a bit jealous of you guys, where you were giving smile to people and enjoying your days, and so I wanted to be part of this journey. So you are an inventor of the very famous Carriere Motion
Yeah.
3D, and the Carriere SLX 3D Self-Ligating Bracket System. Can you
Yes.
tell us more about these two? Pretty successful, worldwide renowned technology and techniques.
Yes, Philippe. Aside of my approach and new concepts on like the Carriere Motion appliance or like the Carriere SLX bracket and the Carriere procedure to solve the overall treatment, I was very much interested in human anatomy. And one of the things is that if you observe the Carriere Motion, the original one, it's an imitation of the coxofemoral joint with certain elements of the scapulohumeral joint.
Mhm.
And this was because one of the subjects that I wanted to approach was to have an efficient rotation and an efficient uprighting of our molars.
Mhm.
The upper first molar is the element that will construct the stability of the cases in a long run. If we want to have long-term stability, we need to construct the perfect scenario of positioning of the molars. I
Mhm.
wanted to move posterior segments instead of moving single tooth. So in order to move all the posterior segments in a block, what we did is to design a kind of bar that was attaching on the canine, that was attached on the molar, with a joint that was imitating Mother Nature.
Mhm.
This means that the motion appliance, it's an appliance that is biomimetic, biomimetic, And then what I wanted is to do a computer without electricity, driven by design. The design was driving the movements into the direction that we wanted. With what? With raw force. What is the raw force? The elastic traction. The elastic traction is raw, is not focused, but what it converts the traction of the elastics that has only just traction into a detailed, accurate, and useful movements for the easiness of the treatments of our patients in orthodontics.
I will ask you to step back, Luis. I will ask you to go back few years behind and to try to remember, because today everything sounds easy in your mouth, and because you have put a lot of thinking into this and lots of design work and so on, and I know how hard is it to build a company. Okay, but so step back and imagine yourself. You're just an orthodontist, not an inventor, and you have this brilliant idea of mimicking the biology, mimicking the bones, and etc., and trying to apply the force as you did. What was your go-to strategy, the first step to actually, okay, look guys, I've got this idea, I need to design a first appliance, which was obviously not successful, the first one, as every prototype, and the second one and third one, etc., as every inventor faced. What was the different step? What happened? Tell us more about this
Well,
historical aspect of your life.
yeah, I am a dreamer, and I would say that I am 3D dreamer. So when I think on something, I can see it inside in 3D, or I can imagine it a little bit in 3D, meaning that makes me quite so not simple but not painful to conceptualize something that is abstract. Okay, so I was seeing perfectly the concept and was seeing the design inside of what I wanted. I was seeing the form of the motion appliance exactly as I wanted. And then what I did is that, hey, I have this idea, so I don't draw fantastically, but I sculpture well. So I took
Oh,
a piece of soap, and I sculptured, crack, the form of what I wanted. Then, since 1995, I was working on virtual reality in orthodontics. This is why they gave me the Joseph E. Johnson Award at the American Association of Orthodontics, because I presented a program on virtual reality and totally interactive and in real time in 1995. In 1995. So I was
yesterday.
in contact with people of their 3D virtual reality. And I took my piece of soap sculpture, said, hey, Juan Carlos, at that time was the parent, put this in the computer. He was working with Maya, and he did a beautiful design, transported this sculpture into the computer. Once we had this in the computer, I was able to improve the design, improve it, because I removed the abstraction and then I was focusing on something that was in front of myself, okay? And focusing, okay? Then I went into the pattern aspect, no? Now, when everything was conceptualized, I went into the pattern aspect and properly managed this subject. And afterwards, it was a part of taking the attention of the industry. Difficult, very difficult.
Very difficult.
Very
Very
difficult.
difficult.
So first I connected with several famous companies. The first company I connected was with Zia Christie in
Oh,
Invisalign.
Align
First one.
technology at that time.
Yes,
Yeah.
yes, yes.
Oh my God.
This was in 2001. And he told me, come here and you explain me. And I was there one week. But at that time, they were losing a lot of money. I said, hey, love it. I think it would be very good for our for expanding what we are doing, but now our focus is into
Getting back on
flipping
track with it.
and what he said, break even, to do the break even. Okay. Second, I went into another company, and that is very famous and very successful as well. And the people in front, they were people of not orthodontists. They were engineers, and they said, "Hey, we don't think that is our idea to go into this." No. So my father told me, Luis, I have a good friend in Texas that he's orthodontist and he has a nice company, it's Class 1 Orthodontics. And he called him and he said, I'm coming. Jim Reynolds, Dr. Jim Reynolds. He came with 85 years all the way down to Barcelona to look at this. And he saw it and he said, Luis, I want that. This is the best innovation I have seen in the last 20 years. And said, oh, fantastic.
Nice.
So we started like that.
Nice, beautiful. So I think lots of people will know Carriere Motion and especially your philosophy, but can you elaborate a bit more about the philosophy behind Carriere Motion and the Carriere techniques in general?
Yes. The Carriere technique, the Carriere Motion appliance, the Carriere technique, the Carriere treatment protocol, the Carriere system is a system in which everything is around simplification and trying to diminish the back and forth, trying to focus on the attention. So we split the treatment in two moments. First one, solving the sagittal problem. The most difficult dimensions to solve in orthodontics is the sagittal, even in class 2 or in class 3. So if you convert every class 2 into a class 1 case at the beginning of the treatment, or every class 3 into a class 1 case at the beginning of the treatment, you are removing one of the biggest problems of your treatment, and you can then focus on the other dimensions that are much easier to treat, but with the absence of the problem that is the big issue or the big energy demanding element in your treatment. So the motion appliance converts every class 2 into a class 1 or every class 3 into a class 1 at the beginning of the treatment, in the first 3-4 months of treatment. Now, the next stage is how to maintain that, how to keep everything in place and accomplish a perfect occlusion of the posterior segments and of the finishing of the case. Well, I designed a new concept of bracket, a Carriere bracket that was a very efficient bracket with coplanar elements to be able to do a bracket that was very low profile, being able to bring the wire as closer as we could to the surface of the tooth and converting it into a self-ligating bracket. And all the treatment was perfectly designed to be one step of the other. This means that if I fall ill in my practice and an expert of our system comes to my practice, he will perfectly know in which moment is our patient and which is the next stage to follow. This is the important thing.
This is in the case that they use your full technique, because we see at
Correct.
DM tons, really. Carriere Motion is becoming a very big standard now. We see it on DentalMonitoring in literally thousands and thousands of cases every single week. So it's a very successful procedure, but it's not always with the Carriere self-ligating bracket. And I believe what you're saying here is, in terms of predictability, to complete the portfolio of product is allowing doctors to be far more predictable from the get-go. See if I understand this very well. My following question is, one of the elements that we have seen on the monitoring is, because it's an extremely successful class 2 corrector, class 3 corrector, it's the dependence on compliance as always, and on the wear of elastic, etc. What advice would you give to the doctor to be be the most efficient with Carriere and the aspect of compliance?
Well, today we have the Carriere Motion Pro. Carriere Motion Pro
Okay.
is one of the most giant steps that I have done on boosting the efficiency of the Carriere Motion appliance. I have been converting the spherical joint of the motion appliance into a condyle shape, like the temporomandibular condyle. This is giving us the perfect flow into the rotation and uprighting without collision points that is boosting exponentially the efficiency of the appliance. Simultaneously, on top of this, we have incorporated the capacity of having a drop-in hook in the mesial arm. And now we are ready to release very soon the Carriere Motion Pro X. What is the Carriere Motion Pro X? The Carriere Motion Pro X will be an appliance that is able to be have traction from behind and from from the anterior part, with a dropping hook, and also to insert elements, auxiliaries in the posterior segment, in order to be able to use it with cooperation, but having the capacity of converting this appliance into a non-compliance appliance and super efficient non-compliance appliance in a patient that does not cooperate. So you give the chance to a patient, and you say, hey, patient, you cooperate. I don't have issues of cooperation, by the way, because I try to seduct the patient and try to inform about the importance of putting gasoline in your car if you want to go on vacation. You cannot go on vacation with your car if you don't put gasoline on the tank. But the elastics are.
I think I can give you. I think I can give you an element here, Luis. It's across most of the class 2 correctors that we see on the monitoring. It's actually the Carriere that get one of the best score on compliance because of the efficiency. Because we see very often that the compliance decrease by the time that you require compliance from patient, and because of the efficiency, which sometimes is very surprising initially for doctors that they get the result that fast. Because you shorten the period that require compliance, you actually get a far better compliance than the average. But now, which is pretty unique, that you're telling me that even in the case of non-compliance, you can transform with no additional big procedure the non-compliant case into, you don't have the choice. Okay, I will put this additional element that will force you to actually comply. That's brilliant, Luis. That's really brilliant. But
thank you very much. Thank you very much.
But really, me as an observer, as a large scale observer of your technique, what I love is because of the speed that brings the compliance. This is really the core element of
the simplicity as well. Simplicity, because when I have a patient that does not want to cooperate, and I say, hey, let's go for the alternatives, and I show that. They say, no, I don't want this. If you want this, the trendy one, hey, cooperate a little bit. Eh?
Okay, your time is very precious, but so I want to take your brain to go to the future and to go to something that will help people to dream as much as you dream, Luis. I will always remember the conversation that we had with your office where we were talking about this treatment project
with Mark as well.
With Mark, I miss him. Give me your insight. Give our audience the insight on future of orthodontics. How do you see our? Yes.
I see orthodontics in an absolute hybrid approach in all the techniques that we have. I see orthodontics in which the patient is going to push us into simplifying the treatment and boosting the efficiency of our treatments. I see orthodontics into the deep knowledge that our patients are going to have about the deep impact that orthodontics can do on their faces. And I see orthodontics on diminishing dramatically the number of appointments to come into the office. And how can we do that? Well, we need to merge with technology, with the remote monitoring, but to keep a perfect a perfect capacity of having an eye on the house of the patient and using the patient as our hands in the distance. Many things that we do in the office can be perfectly done by the patient in their houses, or can we accomplish in their houses. So many appointments today are totally unnecessary. Today, we have an absolute approach in our system in which we have many patients coming from outside of Spain, especially class 3 patients that they are seeking for a non-surgical approach. And they are coming from everywhere in Europe and Middle East. And these people, they are not to come every month. So we close the case normally in 4 appointments or maximum in 5 appointments. We are done and finished the treatment. But for this, you need 2 things. Goal-oriented design appliances, an adequate treatment strategy and protocol, and the eye in the distance. The eye in the distance. You cannot be blind. The orthodontist has to have a view by the technology of being able to monitor in the distance.
This is our ultimate goal. Our ultimate goal is not to not see the patient. Our ultimate goal is to see the patient as much that they need to be seen.
Correct.
It's if a patient needs to be 5 times for a treatment, they need to be seen 5 times, not 6, not 7, not 8. But if they need to be seen 20 times, I exaggerate, of course, then you need to see them 20 times. And this, if you don't have a look and if you don't have vision on what is happening, how your treatment projection is actually happening inside the mouse, and this is what we are trying to help the industry with, you cannot achieve this ultimate goal. The patient cannot be against the fact that you really want their treatment to always progress and being tracking based on what you have planned. So, Luis, thank you so much for your time. It's an honor. I'm going to Spain soon, so if you give me the opportunity, I will come to see you again.
To have some good food.
Beautiful dinner like last time. This amazing restaurant. I'm not going to do an ad for a restaurant today, but there is a beautiful restaurant. Just for that, go to see Luis in Barcelona. See you, Luis. Thank you so much.
Philippe, congratulations for everything. Take care.
Thank you. Bye.